Muted.
Important to the work that you do, and very, very important to those families and children that you are serving every day and caring for. So as many of you probably are aware, the President's budget, his proposed budget, was issued last week, and this is his 8th and final budget. And so there are a lot of things in there that would be fantastic to see happen. I think the reality of the political landscape is such that that may not come to be, but it definitely puts out some ideas for debate and for discussion, not only through this coming fiscal year, the conversation around fiscal 2017 budget, but also just where we want to go as a country in addressing poverty. Regan will talk later about the conversation around poverty really picking up some steam and is actually working its way into our national debate and conversation, not only in the campaigns, but just in general, which is a positive thing that has obviously some opportunities and threats in there. And so, as I'm sure without a doubt you all know, that we are in an election year. And so that does add a little bit of complexity to the budget process, because the budget is not only a policy document, it's also a political document. And so let me just go through on the next slide here, Jay, to talk a little bit about what we're really looking at when we talk about the federal budget. And so you can see there that there are two types of spending. Now, all I'm going to talk about today is the spending, the outlays in the budget. There's another spending side of the budget, which of course is the tax code. And we're not going to talk about that much today, but in the tax code there is spending that help low-income families, such as the Earned Income Tax Credit, the Refundable Child Tax Credit, the Child C.A.R.E. Tax Credit, mortgage deductions, business deductions and write-offs. So there's another whole side to the spending. But what we're going to look at particularly is outlays. And you'll see there in that little pie chart, you know, I have some pie slices there. There's the lemon meringue piece of pie, if you will, which is the defense and security portion of our spending. There's the, as you might want to call, the lemon meringue slice of pie, which is Social Security retirement. And then maybe we'll call that the banana cream slice of the pie, which is health care, Medicare, Medicaid. And then there's the gray slice of pie. I'm going to try to pretend to know what flavor that is. And those are safety net programs. Those include things such as food stamps, SNAP, TANF, which also, as you know, helps to fund child care, the mandatory entitlement side of the child care program. And those are all, the mandatory part, which is really the Social Security, health care, and safety net programs, are mandatory entitlement spending. That spending is going to go out the door unless Congress changes the law, and changes the law by changing the eligibility or the level of benefits that are available. And so that is more or less on autopilot. Then there's that light gray piece of the pie, the interest on the debt, and that again it is what it is. It's just like when you get your mortgage statement or a credit card statement or your car loan, the interest you're paying on that loan, you just have to pay whatever the interest is. So that's what, so that again is not anything that we have control over. We just have to pay that. So then there's the blue slice of the pie, and that's the non-defense discretionary part of spending in the federal budget. And that is divided up, that portion is divided up among 11 appropriation subcommittees. And they cover everything from education to the Department of Labor, to EPA, to Department of Energy, to National Institutes of Health in the Labor and Health and Human Services portion. It includes the discretionary side of child care spending. And as you'll see, that blue piece of pie, as it gets divided up, it's not evenly divided. It's not divided by 11. Some subcommittees get larger portions than others. So one of the largest non-defense discretionary appropriations goes to veterans services, for example. And then that darker yellow piece of pie, the defense, that is also discretionary spending. So the darker yellow and blue pieces of pie are spending and appropriations bills that Congress must pass every year. So when Congress is talking about what they're going to spend for fiscal year 17, that's really the portion of the federal budget that they're looking at, which, as you can see, is less than half of the overall federal budget. And when you get down to dividing it into the non-defense discretionary, we're talking about a pretty small piece of the pie, relatively speaking. So in the next slide, you'll see that we have budget deals. So if you'll remember way back in 2010, the Budget Control Act put in the sequester and some really tight spending caps on discretionary spending. And those tight caps were equally divided between defense and non-defense. And the idea was to make this so harsh that it would force a bipartisan agreement on the budget and on spending for the foreseeable future. And we were all certain, right, remember, that the sequester would never go into effect and this would never happen. It would be so harsh on both defense and non-defense. The Republicans and Democrats would come together and, you know, have a kumbaya moment and decide what the federal levy spending levels really should be to meet all of our national needs. Well, that did not come to be. And so the very harsh sequestration and tight budget caps went into effect. And they were so harsh that in 2014, then Budget Committee chairs Patty Murray and Paul Ryan came together with a deal for spending for 2014 and 2015, lifting the caps just a little bit, just to provide some relief because the appropriators were really unable to write bills at those very tight caps. So that went into effect for a couple years, and then if you'll remember last year, as they began working on the fiscal year 2016 budget and the spending bills, they hit the same problem because the caps were back into effect and they just were not able to pass bills in a way that really adequately funded what our nation needed. So in the fall, there was a bipartisan budget agreement that was agreed to by then Speaker John Boehner and the President and the Senate. There was a lot of debate and a lot of controversy around that, to the extent that Speaker Boehner actually lost one of the reasons he lost his job as Speaker of the House. But we did forge a budget agreement for 2016 and for this coming year. So the budget caps are a little bit higher than what they were in the Budget Control Act. But nonetheless, if you look at this next slide, we have what we call our roadmap of disinvestment. And so the common wisdom that the federal government and spending is just growing out of control, this really dispels that myth. That is not true. We are headed towards, even with some of this sequester relief and some of the small increases in the budget caps, we are still headed towards the lowest spending on discretionary spending as we have seen historically. Our map goes back to 1962, which is when they started keeping data on this. So we're looking as a share of GDP, the federal spending that will be available for the kinds of programs that we really care about will still remain in a very austere situation and very low caps. So while we've received some of these budget deals have provided some relief, it hasn't been really substantial. And we need to keep up that message that we need to continue to raise the caps, and we need to be able to have enough resources for what we really need to do, again, to meet our needs. So last year, when we had this bipartisan budget agreement in 2016 and 2017, you'll see in this next graph chart that we took what those 11 subcommittees are and looked to see where did that new money go. And there are two subcommittees, Transportation HUD, which is Transportation, Housing, Urban Development, and the Labor, HHS, Health and Human Services, and Education subcommittees really got shortchanged, which is really too bad because a lot of the advocates for these programs that are found in these subcommittees were really committed and did some great advocacy work in creating the space for those budget caps to be lifted. And these are the two subcommittees where we find the most low-income programs. So this is where you find Section 8 rental assistance. This is where you find WIC, where you find your discretionary child care money, where the Head Start money is. It's in those red bars there. And they really didn't get their fair share of where that extra money should go. And so as we head into 2017, we ask ourselves, so what will happen? We know where the spending level is. And so what Congress can do this spring is put together a budget resolution which sets the amount to be spent for non-defense discretionary spending as well as the discretionary spending for that matter. But the 302A we already know because that was part of the budget agreement, bipartisan budget agreement last fall. And so the amount available for fiscal year 2017 for that blue piece of pie, if you will, is $527 billion, which, you know, even in DC terms, is a lot of money, but that's to fund all 11 of those subcommittees. And so there's actually, when you start dividing that up, we're not looking at any great extra amounts of money available to fund our programs or what we consider priority for the families and children that we serve. And we're starting out in the hole because the very little bit of increased spending that is needed, that is available, is needed to maintain the same level of services. So veterans' health care continues to rise just because health care costs continue to rise. Rental assistance goes up every year just to maintain the same number of rental vouchers because the rents go up and the cost of utilities go up. So to keep the same amount of vouchers out on the streets, you have to spend more money. So in March, we expect the House and Senate to debate whether or not they will keep the cap at the level that was agreed to in the budget deal. Some of the Republicans want to see spending levels below what was agreed to in the budget. Speaker Ryan and chairman of the appropriations committees and Senator Mitch McConnell, the leader of the Senate, would like to honor the agreement and keep the caps at the same level, but there's a big fight going on right now. And so once they agree to that amount, if they agree to the original amount that was as part of the negotiated agreement in the fall, the $527 billion, the appropriations chairman in the House and Senate will divvy that amount up to the different subcommittees, to Labor HHS, to Transportation HUD, to Energy and Water, etc. So once they do that, then what? Well, as you'll see from this slide, it's a little bit of crystal ball gazing here because we don't know exactly what's going to happen. So if they get together with a budget resolution, they might have the budget committees debate that and take that to the floor. If they don't do a budget resolution, which is only a blueprint, it does not have the force of law, and they just stick with the caps that were agreed to in the budget agreement, the appropriations subcommittees will have their allocations given to the subcommittees, and they'll mark up bills and bring them to the floor. And some of those bills will make it to the House floor. You might have one or two that will make it to the Senate floor. And in the House, they won't have any problem passing them. And if they kind of try to write bills that will appease the full Republican caucus, both the kind of Tea Party wing as well as more the mainstream, if they need to start relying on Democratic votes, then I think the whole process will probably come to a screeching halt. But then this year, both the parties' conventions are at the end of July. So there is a very long summer recess. So whatever they don't get done before mid-July is going to be really difficult to see how the process continues by regular order. So Congress will be gone mid-July through August. And then they'll come back in September because, as we know, the federal fiscal year ends September 30th. And so they will need to pass what we call a continuing resolution, which will just keep government spending on autopilot at the fiscal year 2016 levels. They'll get that done in September. Highly unlikely they would have a government shutdown right before an election. That doesn't usually play out well. And to do it, weeks before an election, they'll just come back probably, agree to a straightforward CR, and go back out on the campaign trail, through October. In November, we have the election. Of course, we don't know what's going to happen in the election, so kind of depending on that outcome, in December, they'll come back for the lame duck. And at that point, they will start negotiating, depending on who wins the White House, what the numbers will be like for the next Congress in terms of House and Senate Democrats and Republicans. They will decide either to do one big, large spending bill called an omnibus, which they may incorporate some other things that are pending. If the child nutrition bill hasn't passed yet, for example, they might throw that into the omnibus. There's a couple of housing, Section 8 reform bill that's pending. If that doesn't get done, it passed the House. If they don't get it through the Senate, they might throw that in. Or they may decide that, depending on, because of the outcome of the election, that it's better for them just to kick the can into calendar year 2017 and pass a continuing resolution, let's say until March, and not take things back up until the new administration and new Congress gets settled in. So, so it's a lot of hurry up and wait, I would say, on budget and appropriations, but it's important for members of Congress to hear the priorities. They have deadlines of mid-March. I think in the Senate it's March 15th, and in the House March 17th, that members need to provide the appropriations committees for what their personal priorities are. So this is a good time to reach out to members and let them know what you're thinking and what would be helpful and where some gaps are in resources or what's working well and what they should keep funding. And then there's some other opportunities here. As you can see in these threats and opportunities, on the next slide, you'll see in the corner there, there's the House calendar. So the House is in for 111 days this year, which is one of the shortest legislative sessions. It's about the same length as a part-time state legislature. And in fact, it's already shorter than 111 days because they've already had some snow days. And unlike school districts, Congress doesn't bother to make up snow days. So they're even less than 111. And so there's other things pending out there, the reconciliation instructions. So if they do a budget resolution, they could give instructions to the committees that oversee welfare, safety net programs, health care programs, nutrition programs, and tell them they were required to find a certain amount of savings, which could be threats to TANF, to food stamps, again to the possibly to the mandatory part of child care, although frankly I think the child care program is a little safer in that arena. Could be a big poverty initiative. Speaker Ryan had introduced last year a proposal called the Opportunity Grant proposal, which I think Regan's going to talk about in a little bit here, that while he may be really trying to help those families escape the trap of poverty, as he calls it, could really undermine the safety net. There's discussion about block granting SNAP and turning that and just giving money to the states to do their own kinds of programs. There's some good things that could happen, an expanded earned income tax credit for workers without dependent kids, which again helps children anyway because that would go to non-custodial parents. The child nutrition bill, as I mentioned, is still pending, which includes the Child C.A.R.E. and adult care feeding program, as well as school meals and WIC, and rental assistance reform, or the omnibus, where they kind of start to roll things in and it becomes a bit of a Christmas tree bill where everybody's hanging an ornament on that bill. So like I said, it's a sausage-making process, and so it gets a little messy and is not always pretty to watch. And again, not entirely clear how things are going to roll out this year, but we can't take our eyes off the ball, and it will be a little bit of a challenge because it will be happening in fits and starts with lots of gaps of waiting time in between this year. So Jay, I think I'm just going to, at this point, turn it over to Regan to talk about really what we are looking at in terms of the safety net and how some of this is being talked about in the Congress on both sides, and then we can do some questions.
Great, Kathy, thank you very much. And just bear me for one moment. Fantastic presentation. I am now going to hand it over to Regan. Regan, you there?
Yep, I'm here.
Okay, take it away.
Okay, yep. Great. All right, well, thanks, everyone. So I do want to just build upon what Kathy has kind of laid out to get a little bit more into the overarching themes and messages that you might be hearing around poverty this year, as well as the opportunities and challenges that we could be facing over the next few months, also with the context that Kathy laid out. So the good news is that poverty is becoming an issue of interest by policymakers, as Kathy mentioned, including Speaker of the House Paul Ryan, who has placed this issue at the top of his agenda. And as Kathy also mentioned, he has indicated that he'll likely be releasing a proposal to reform the safety net and tackle poverty, potentially in the coming weeks and months. So while it's great news that policymakers are showing an interest in this topic, it's not all good news necessarily when you consider the potential serious challenges that we could face to critically important safety net programs, including food assistance and housing and other types of safety net programs. We've seen this renewed discussion around the safety net, and you may have heard this, around hearings on Capitol Hill over the past year. We've seen it in high-profile speeches and other events. And we've also seen it in various policies and proposals in the states as well. Earlier this year, several of the Republican presidential candidates participated in a forum on poverty in South Carolina. It was moderated by Speaker Ryan and Senator Tim Scott. And while there were some really good ideas that came out of this forum, including expanding as Kathy mentioned, expanding the earned income tax credit to workers who are currently left out, the forum also highlighted some concerning themes as well that we've heard discussed over the past several months, such as the need for work requirements, or the idea that the safety net discourages work, the idea that the federal government is hampering states and communities in providing assistance and reducing poverty, and then the overarching idea that the safety net as it stands is failing. These are just some of the themes that we continue to hear over and over. And I want to issue a word of caution with all of these themes. First, I would like to debunk the notion that the safety net's not working. We do hear this claim very often, generally in the context that despite spending more money on the safety net since the war on poverty in the 1960s, poverty hasn't gone down. This is incorrect for a few reasons. And the first thing to understand is that when people are making this claim, they're referring to a measure of poverty that doesn't count the receipt of most safety net benefits. So that means that this is a measure of poverty, or this measure of poverty that they're using is looking only at what the poverty rate would be without critical safety net programs like SNAP and the earned income tax credit. So it's pretty hard to say that safety net isn't working when you're using a measure of poverty that isn't even counting those benefits. So when you do count safety net benefits using a more accurate measure of poverty, you'll find that poverty has actually fallen significantly. And our safety net is doing a lot to keep people out of poverty. In 2014, safety net programs lifted out of poverty 42% of people who would have otherwise been poor. That is a significant contrast to the around 4% of people that were lifted out of poverty by the safety net in 1967. Food stamps alone kept nearly 5 million people out of poverty in 2014. And, the safety net is clearly doing a lot to reduce poverty and has a lot of benefits in the short term, but it's also very important to understand that the safety net is providing some very critical long-term benefits to those who receive them as well, particularly children. Research shows that safety net programs are, helping to, several safety net programs are helping to increase educational attainment. They provide better health outcomes for children and adults in the long term, and higher rates of college graduation and earnings over the long term. So the safety net's doing an enormous amount of good, both at improving lives and opportunity and reducing poverty throughout the country. So that's something I think we need to make clear. And that brings me to another thing that we're hearing quite a bit of, and that is that the safety net is discouraging work, or that we need to institute work requirements. And I'm sure as child care providers and connectors, you know firsthand the difficulties that people have in finding affordable, safe child care for their children, and you likely know many low-income people who may receive some support from safety net programs, but who are also working very hard at one or sometimes multiple jobs to make ends meet and provide for their children. And the reality is that our safety net is already really geared toward helping those who are working, and many of our safety net programs already do have work requirements. For instance, the Earned Income Tax Credit is only available to workers, and the majority of people receiving things like food stamps or SNAP are seniors, children, or people with disabilities, but for those who are able-bodied and can work, the majority do. Often when policymakers say we need more work requirements in our safety net programs, they are not also providing the tools necessary to make sure that people are actually able to get a job or find job training. And in many cases, it simply means that people will lose assistance. And we're seeing this actually in action right now with SNAP, which is food stamps, as some of the poorest Americans are beginning to lose food assistance around the country because they can't find a job or have significant barriers to getting a job, like lack of education or learning disability, or don't have access to a work training program, or simply not working enough hours to meet a work requirement that is being reinstated for able-bodied adults between the ages of 18 and 49 throughout the country in several states. So, what we're seeing with that is that people are simply losing assistance in a lot of these cases because they can't meet this requirement. The other theme that you may hear a lot about is the need to provide flexibility to states and communities around safety net programs. And as Kathy noted, an example of this is an idea that Speaker Ryan has promoted called an opportunity grant, which would consolidate 11 safety net and related programs, things from food stamps to housing vouchers, child care, and the community development block grant into a single block grant to states. We've got real concerns about this proposal that it could increase poverty and hardship. Converting programs like SNAP into a block grant to states would mean that instead of responding to increased need, particularly in times like recessions like we just went through, states would be given a fixed amount of funding for the year, and this would not respond to changes in the need at any given time. And that's something that makes SNAP so effective, as it stands right now. Block grant structures like this have been shown to have significant reductions in funding over time, and funding is often used by states for other purposes than intended. And a good example of this is the TANF program, which is cash assistance, or often known as welfare, which was converted to a block grant back in the 1990s. And unlike SNAP, TANF during the last recession did not respond to the increased need. The caseloads did not increase, even though clearly there were more people that were eligible and needed assistance. And funding has fallen for the program over time and been used for other purposes than was intended. Nationwide, currently an average of only 23 out of 100 families who are eligible for TANF assistance receive it. And in some states, it's fewer than 10 out of every 100 families. And this contrasts significantly with the 68 out of 100 eligible families who received assistance prior to the program being converted to a block grant. So as a result, we have seen significant increases in deep poverty for families and children over the same amount of time. And it does bring up, as Kathy mentioned, an issue for child care as well. In 2014, many states spent less than half of federal and state TANF funding on core welfare reform services, including child care. And in the aftermath of the recession, most states did cut their child care funding. It's been, and it has been restored in some cases or improved, but those improvements have only been modest in many cases. And child care assistance continues to reach only a fraction of families in need. So I just want to bring these themes to your attention because I do think we have been hearing them, we've been seeing them in like I said, in speeches and different events and on hearings on the Hill and in the states. And I think that these are things we will continue to hear, among others. And it's just important to keep in mind, what the reality behind these messages may mean for people who depend on these safety net programs to make ends meet and feed their children and keep a roof over their heads and many other things. So it's very important to know what the reality is behind this. So you'll likely hear more as the year rolls around, and I think if you have any questions or about this or any of the issues you're hearing, or different proposals that may come up, and you really are interested in learning more or kind of finding out more about the issue, we are happy to help and we'll be happy to be of assistance to you or provide any guidance to you that you may need. So that's it for me.
Regan, thank you very much for this, and I just wanted to go ahead and share everyone's contact information before we move forward. And if you have any questions for either Regan or Kathy, they'd be more than happy to help you. And speaking of questions, if anyone has questions on this call they would like to ask, please feel free to do so via the chat feature, which you should be able to see on your screen. If anyone has any questions, the three of us will be happy to help answer them. So moving forward, just wanted to a lot of the focus of this today's session really has been obviously on appropriations and budget resolution and which is obviously big, something Congress has to do every year. And this year we expect, there are definitely a lot of unknowns with being an election year. Before we would like to try to close out the remainder of this presentation to focus on a bill that was just introduced last week. It was, for many on the phone, I think almost all of you are aware, that for the past two budget cycles, President Obama has proposed this new Child C.A.R.E. initiative. And it's roughly $82 billion in new funding over 10 years. What's important about the President's initiative is that, and I know almost everyone on the call can relate to this, with the reauthorization of CCDBG, it did provide about $400 million in new discretionary funding over the course of 5 years. However, it did not change the contribution out of the mandatory pie, which is roughly $2.9 billion annually. This initiative that President Obama and now Senator Bob Casey and Congressman Joseph Crowley and Congresswoman Lois Frankel, basically it took the President's proposal and are trying and it officially drafted it and introduced it as an actual bill. And what this what this bill would do is it would provide $25 billion over 5 years in mandatory funding. It's not the full $82 billion initiative. It's really seen, I think, is seen as a down payment to support the President's initiative. And it was just introduced last week. Obviously, Child C.A.R.E. of America and many other organizations have endorsed this initiative. It's and again, it is it would the biggest news here is they would provide critical new funding via the mandatory spending avenue, which would obviously provide a significant amount of access for new children and families to benefit from. It does have, there are four major sections of this bill, and really what the goal of this bill would be as far as who would benefit. And one of them obviously is infants and toddlers. The legislation would actually ensure families that have with infants and toddlers who are living at or below what's known as the federal poverty level, and roughly that would be 200% of the federal poverty level, and need child care, would help them gain access to it through by fiscal year 2021. And obviously, any legislation that is trying to address poverty, as is with this one, is to help promote family and economic security and parental employment, as well as trying to support a parent's kind of balancing work and family obligations, and including what are known as everyone knows here, what are non-traditional hours, as with regards to child care. But this bill also tries to assist child care providers, mostly by ensuring that CCDBG payment rates are set at levels high enough to support quality child care for children under the age of 4, as well as support fair wages for child care workers. The next one, which is quality child care for all, it's an effort to promote and assist infant and toddler child care providers, basically in improving the quality of the programs, by strengthening skills of, kind of strengthening the workforce, aligning that are aligned with the recent National Academies of Science report, the Transforming the Workforce for Children Birth Through Age 8, which was actually published last year, and also help providers ensure that children receive services they need by coordinating activities with other community service providers, and then lastly, it would also this bill would also help assist tribal communities, as under this bill, tribes would be allowed to apply for funding to expand access to quality as well as culturally and linguistically appropriate child care for all eligible children and families. They can also use funding to enhance the quality of child care and align it with their early learning system. Now, how this would be done, how states could gain access to this funding if this legislation were passed. I have to say hypothetically this year, then what states would have to do is they would have to submit an amendment to their 3-year CCDF plans, the FY 2016-2018 plans. And obviously, if this legislation were to become law, HHS, the Administration for Children and Families, would be tasked with actually writing the requirements of what they are seeking, and kind of as far as like a state plan and alignment in ways to try to get access to this new funding. So just wanted to, obviously we're going to be promoting, and trying to gain support for this initiative at our annual symposium. Our symposium in April. This is obviously a major ask we're gonna make to Congress as far as like legislative initiatives for this year. So obviously, please stay tuned, as we are going to be promoting this throughout this year. And if we are unsuccessful in trying to get this passed into law this year, we obviously, Senators Casey and Congressman Crowley and Congressman Frankel are going to be committed to try for it again down the road with the new Congress and new administration. So that is it for us on our end. Again, if anyone has questions, please feel free to just type them in the chat box on your screen, and we will try to answer them to the best of our ability. And while I'm thinking about that, Regan, are you there?
Yep, I'm here.
I actually have a question, just because it's regarding Speaker Ryan's opportunity grant. Is there, just because we didn't have it on our screen, but is there a way we can access this plan? Is it available on your website? Or?
So we do have a commentary from Bob from our president, Bob Greenstein, which I can definitely share with you. I don't believe there is a link in there, but that should be pretty. It was part of Speaker Ryan's preliminary proposal that he released last year. But I am happy, if you'd like. Should I enter the link to our commentary on the screen here, or in this message box, or should I send that to you?
You can, I'm trying to think whatever's easiest. If it's easiest to just write in the chat box, if you just want to.
Okay.
Yep.
Sure, I can definitely do that, and that will give you some information on this. That should be helpful.
Mm-hmm. And And again, folks, I've posted our contact information back on the screen again with our email addresses. If you have any questions for any of us, please feel free to reach out. And so far, haven't heard any questions, and want to give people just a few more minutes, an opportunity to either ask a question or even try to provide a comment on the budget, as well as this new House and Senate child care initiative. And while we're here, just trying to facilitate the discussion. Kathy, is there any?
Yeah.
Do you have any other, again, a great presentation on the structure and really the process of how the federal budget moves forward. What are your, I guess I'll ask a question. What do you, and it's all hypothetical, how do you see, I guess, an increase in funding for critical programs as well as continued support for the safety net? How do you see it playing out in a new administration?
So I think that's why it's important this year to keep talking about that, because I think it will begin to set the table for future discussions and policy proposals that will be considered by the next Congress and the next administration. You know, if people are at different town halls or other opportunities to get in front of candidates and to ask them, you know, what do you see as your plan for reducing poverty or making sure that families have enough child care so they can get to good jobs? You know, and make this part of the debate, because it's not naturally going to be part of someone's stump speech. So I think we need to, it's up to us to make this a hot topic, if you will. I think it's also important that even though this, in the end, is probably going to get rolled into some kind of omnibus or CR, that these bills that the appropriations subcommittees will be marking up and voting on in March and April, maybe even into May and June, are still important, because when they go to put together that omnibus package, they're going to look back to see what the subcommittees had intended and had talked about earlier in the year and what they wanted to do. It's important to talk to members now, as I said, because it's important for them to hear what their constituents see as priorities when they begin to put their priority list together for whether they're on the Appropriations Committee or not. As a matter of fact, for non-Appropriation Committees members, this is their most critical time for being able to weigh in early in the process before bills are actually written up. The further the bill gets into the process, the harder it is to amend and add different change numbers and that sort of thing. So, but overall, your question was, what's the outlook for more spending and really raising those caps to an adequate level? And I think that that's going to only happen when there's a significant change in the dynamics in Congress, and when it becomes politically okay for people to start talking about going to the revenue side and putting everything on the table, looking at entitlements. There, you know, if there are ways to save money in entitlements in ways that do not harm beneficiaries, you know, if there's some good ideas, we should consider those. But it's really a matter of putting everything on the table, and to continue to just put these small pieces of pie on the table and say this seems to be where our whole problem is, when clearly that is not the significant part. I mean, the entitlement part that's growing is in retirement and health care, and it's not necessarily because of such generous programs, it's just because of demographic changes and changes in the costs in health care. And so we have to kind of recognize those realities.
Oh, absolutely, and thank you very much for that insight. I have received two questions that I will go ahead and answer. The first one is, for just so everyone's aware, we are recording the session, and it will be posted on Child Care Aware of America's YouTube page by the end of the day today. And you can actually access that page through our public policy section of our website. The other question was one of our listeners, I think, had some audio issues when I was speaking about the Senator Casey, Congressman Crowley, and Congresswoman Frankel Child Care Access Bill. Is the process? I think the question is the process of states trying to draw down funding. Once again, if this bill were to become law, the way states would try to access this funding is they would actually have to submit an amendment to their 3-year Child Care and Development Fund plans, which are actually due in March, just a couple weeks from now. What would actually be required in that plan that states would have to submit to the federal government would be really at the discretion of the Secretary of Health and Human Services, as well as the administration for the administration for children and families. So with that, I am going to go ahead and end our session. Again, many thanks to Kathy and Regan for joining us today, and thanks to all of you for those that asked your questions. And obviously, I just want to echo what Kathy and Regan were saying, and just stay tuned. There's a lot of unknowns this year, but we've still got to continue to keep up the great work we've been engaged with regards to helping children and families. So again,
Jay,
Kathy,
can I just make one last comment? Just
sure.
to put it on people's radar. Part of this Ryan Opportunity Grant, as Regan says, rolls all these programs into one big funding stream and just turns it over to the state. So of those 11 programs, just so people are clear, that incorporates the Child Care and Development Fund into the Opportunity Grant, and would also convert Head Start into a block grant to the state. So, so there's the two programs that you're looking at that you really focus on have some serious implications if this were to, start moving forward.
Yep. So, no, thank you for that. And again, thanks to all you on the phone. And and lastly, the slides to this presentation, we will put them under our federal budget section of our website at Child Care of America later on as well, in addition to the recording. So hope everyone has a great rest of the week, and we will speak with all you